Welcome. I'm Dr. Delilah Reniger, and today, as part of the Aligned Modern Health Digital Doc series, we're going to be talking about recovering from COVID-19, how to help you get back to healthy. At Aligned Modern Health, we look at the patient as a whole person. We use integrated medicine, incorporating chiropractic physical medicine, acupuncture, massage, clinical nutrition, along with functional medicine to address the needs of the whole patient, not just treating a symptom or a condition. This is a little bit about me, but I think the best thing to know about me is just how tickled I am to be a part of Aligned Modern Health as their Director of Functional Medicine, Clinical Nutrition, and the Physical Medicine team. I've been practicing for somewhere in the 34-year range, and I'm really pleased to be a part of a team that looks at the whole patient, treats the whole person to help them get back to health. So wow, what a year or so it has been dealing with COVID-19, things that we are still learning about, things that a year ago we had no idea the year we were in for. I can't imagine there's anyone really left that has not been affected by COVID-19, either personally or a family member or a coworker. And COVID-19 has really been a learning curve for those of us in healthcare because it does not behave in ways that we expect viruses to behave. So we've had to learn and adapt on the fly, so to speak. One of the things we absolutely know about COVID is it affects people in multiple ways, and you can have two people in the same family think that they had the same exposure and they can still have different presentations of the disease, of the virus. It could be respiratory, it could be GI symptoms, it can be vascular, or a combination. The most commonly reported symptoms across the board starts off with fever and chills. Cough can be a part of it, shortness of breath, difficulty breathing, particularly if you have the respiratory presentation. The fatigue, the muscle body aches, things that we typically associate with flu, but I promise you this is not the flu. It is in no way like the flu. The headache, the loss of taste or smell, sore throat, the congestion, the runny nose, again, more of the respiratory presentation. And then the GI can give you the nausea, the vomiting, and the diarrhea. And unlike the typical flu that we think of maybe on an annual basis, that you are sick for a few days and then you bounce back and your life is back to normal, that's not what we're seeing here with our COVID-19 folks who are dealing with it. When we did a survey of hospitalized patients, the most commonly reported lingering symptoms include fatigue and muscle weakness, and that's at a 63% percentage reporting. Difficulty sleeping, a high percentage at 26%. Anxiety and depression, hair loss, smell disorders, altered smell, heart palpitations, joint pain, altered taste, and dizziness. The one thing that all of these have in common is these are very detrimental to the quality of life. So our COVID patients who are dealing with these lingering symptoms are not only dealing with missed work, the pandemic, being isolated, not necessarily maybe having the support system that they normally would have, but these symptoms aren't all going away, or definitely not going away quickly. And again, they're all quality of life. And I will tell you, in talking with folks both personally and professionally, this takes a mental toll on you as well. It is very demoralizing to feel like, "Oh, I'm young and I'm strong and I should be able to get over this. I've gotten over other things and I'm struggling with that." So that's obviously what we're going to talk about today, how to get over that hump. But there's one other group that we need to mention, and that's the long haulers. And these are folks who are still experiencing COVID symptoms months after their actual first symptom, or the episode, if you will, of how they were feeling when they first were exposed to COVID and were positive. And these symptoms, literally debilitating fatigue. And when I say debilitating fatigue, I'm talking about up out of bed in the morning, much a struggle. They go to the shower, it fatigues them so much they go back to bed. And that is what they were able to accomplish for the day. Shortness of breath. I've literally had marathon runners, incredible athletes, say to me, I could go up one flight of stairs. It took me one step at a time and I had to take a break in the middle. And when I got to the top, I was bent over trying to catch my breath as if I had just finished a marathon. Brain fog. This is a really tough one. This one is probably, I can't say the most frustrating of the symptoms, but definitely got to be in the top couple because it affects the memory, it affects your cognition. So here you don't feel good and you feel like you are in this fog that you can't clear up. You cannot clearly think about things. And because of that, it magnifies all of the other symptoms. Difficulty sleeping. I'm just old-fashioned enough to believe and know that the science backs me up that you really don't heal without good sleep. You need that. So in the midst of all this, when your body is trying to recover, you're not able to sleep. Headaches. Again, having something that hurts so significantly impairs your ability to do most anything. And these folks, this is what the long haulers are dealing with. And then lastly, one of the lingering long haul symptoms is this altered or loss of taste and smell. And some folks might think, well, that's not the end of the world. It's not a big deal, but it actually is. Because one of the things that we have to deal with is these folks don't have an appetite. Things don't taste good to them, or they might taste off. And how else are we going to get the nutrients that we need to continue to heal if we're not able to taste and take them in? So this affects that ability to get better. So all of these long hauler experiences are something that we are seeing, unfortunately, far too much. And we're seeing a cluster of these symptoms. So if you or a loved one are dealing with these, there are some things that we can take into account to help. But I will tell you that you don't want to do this alone. We want your recovery to be with someone or some folks who are a team, because one of the hardest things to do for anyone who's been dealing with this type of issue is add one more thing to that list of to-dos. Even though it's a to-do that's going to help you get better, it still can be overwhelming. And I think if you asked folks who are dealing with COVID that regardless of which symptom or symptom group that they're experiencing that's lingering, or they in that long hauler group, everything becomes overwhelming. There is no such thing as a quick trip to the grocery store. There's no longer that working out that you did that, gave you your mental sanity and your relief and your, keeping yourself feeling good. Those things have truly gone by the wayside. So in the recovery, I invite you to come along with us. We can hold your hand and help you take those next steps, because regardless of what your appropriate next step is, to do it by yourself, I think, is a pretty tough thing. So the very first place we want to start in your recovery is breathing. And when we talk about breathing, every single one that are listed here are promoting relaxation, because that is also another problem, and that is that stress that comes along with dealing with COVID. Lion, just to give you an idea, and all of these, if you put these into YouTube or Google, you will get wonderful demonstrations. There's a lot of yoga sites that demonstrate these. The lion I like because it relieves tension in your face and chest, allowing you to take a really nice, big, deep breath. The alternate nostril, if you happen to be one that has a vascular, cardiovascular presentation of COVID, I love this one because it actually helps enhance that cardiovascular side of things and lowers the heart rate and can, again, promote relaxation. And that's a really simple one. You close a nostril, you inhale, you're going to do a count, you close, and you exhale through the other. I inhale through this, close it off, and exhale through the opposite or alternate nostril. And you can do a cycle literally of 5 minutes. One of the things when we start talking with folks about the first steps, I think they're expecting something a little bit more dramatic than talking about breath. But let me share with you what we know so far about some of the things breathing can do. And you may surprise you. I know when I first learned it did me, but it's fascinating, and it goes to the power of what our body can do. Breathing, and Mayo Clinic has done some research on this, not with COVID, but with other viruses. And remember, we don't have a lot of research with COVID. So what we're having to do is extrapolate other information that's applied to other viruses and bring it in and utilize it here for our patients. And, you know, a little bit trial by error, I freely admit that, but we're doing it based on what we know from other things. So with other viruses, they find that there are particular viruses, this comes into this cognition point, where the virus, and the term they used, and I really like it, is it kind of hijacks your brain pathways, and it interferes with that cognition, it interferes with mood, and it interferes with anxiety and depression in a bad way. So breathing, they did tests where they did an MRI of the brain, and they had the patient do breathing exercises through a 90-day period of time, and then they took the MRI again. Now, the great part is through that 90 days, the patients were reporting that they felt better, they felt more in control, their anxiety had reduced, their virus symptoms had also improved. But the MRI actually demonstrated that white matter increased as far as the size in the brain. So really great. So breathing, as fundamental as it is, or basic maybe, it's really not. It's absolutely key to the rest of what we want to do. So I really encourage that you take a look at these to do those. Incorporate whichever one. These are many, many choices. You pick the one that works and that you like to do, that you can do consistently, because it does need to be a daily practice. By the way, there are apps for your phone for breathing. I use one. I'll pull up my phone here and make sure I give it to you exactly correctly. And it is called Breathe, just plain old Breathe, and I love it. So there's plenty of choices out there. So what else can we do? Starting with breathing, the next thing we want to do is movement. Now, again, talking to a lot of athletes, that movement for them is training for a 10K or a half or a whole marathon. I get it when we talk about the very first thing we want to do is just get you walking. Literally, I'm not wanting to create a great deal of oxidation. I want to get the body, again, very gently moving in the right direction to get that healing. So if you're experiencing debilitating fatigue, we need to support you in other ways. But maybe your goal for the day is to get up out of bed and go towards the shower 2 times. because once was so bad, we're going to work up very slowly. So we want to do this, and how you want to move can be something you can discuss with your provider, but only after we begin breathing do we want to do that. Sufficient hydration. I kind of chuckle at this. This is something that we all know is important, but is sometimes difficult to do. And only because I think we don't recognize how critical drinking good, clean water is. To give you an idea on how it affects COVID, if you are dehydrated, if you are deficient in your water, your airways will actually restrict themselves. They become smaller to help minimize water loss, because we lose a great deal of moisture through exhaling. So right off the bat, if you're dealing with upper respiratory breathing issues with COVID, we want you to be sufficient, because we don't want to pile on and have that extra minimization or restriction of the airway. The other thing that water does is it helps thin the viscosity, so the blood isn't as thick, because thickness affects both flow and blood pressure. And so if you have the vascular side of things, that's really critical, that you maintain the sufficient amount of hydration to support that blood flow. And of course, everyone, I think, is familiar that water helps flush out the byproducts both through urine and feces, and that's important to do, as well as sweat. Good sleep hygiene. So this goes back to, please have a dark room, something that your body knows that it's time to sleep. Please know that you don't want to have screen time at least an hour before. Turn those screens off. And in the morning when you wake up, particularly if you struggle, see if you can get in front of a window where there's natural sunlight, or go outside on your porch and let that sun shine down on you. It tells your brain and the regulatory system in your brain that it's the beginning of the day and this is your cycle. Healthy food choices, obviously an anti-inflammatory diet, good whole foods, vegetables, fruit, lean, non-obese meat, meaning high in omega-3s, are excellent choices. I love chicken soup, and I particularly left this on here because it does have, for respiratory in particular, the spices help with the immune system. The heat helps break up the mucus and helps it drain. And the chicken itself is an easy to digest protein. So all of those lend themselves to offering soothing symptomatic care. Honey helps those throats and sinuses, or excuse me, I should say just throat, for coating it and helping it. The honey can have an antimicrobial, which will help the whole upper respiratory sinuses and throat. Steam, same thing, get everything moist. That does make a difference. When your nasal passages are dry, they're more susceptible to allergy and infection. So both water drinking and steam helps those. Lukewarm baths, and if you want to throw some Epsom salts in there for that joint pain, by all means, but that is a way to reduce that stress, bring down the stress of the day as well as the symptoms, and relaxes into hopefully having a better night's sleep. The mental health regimen, whatever yours is, I hope you've been able to stick with it, whether it's journaling, guided visual discovery, doing a coloring book, any of those things that help you, because the mental part of it is very, very important. I mentioned already the breathing, all of that can be a really great part of it. And there are apps like Calm or Chill that you can do that will help remind you to take care of this aspect of yourself. And of course, my very favorite is acupuncture. Acupuncture lends itself very well to reducing that stress and helping you deal with whatever is going on for you in the COVID world here with these symptoms. So I really want to encourage the self-care. It's incredibly important. In no way is it being selfish. I hear that sometimes, not in the least. The following that I'm going to wrap up the whole presentation with are things that you can do for the nutraceutical side of things. And nutraceuticals are supplements or vitamins, but when we say nutraceutical, it's because we're utilizing them for an outcome. So this would be something that you would talk to your functional medicine provider about. The very first one we're going to mention is vitamin C. And this one we know it has fairly strong evidence of its work with helping to support both the innate, your immune system that you're born with, and the adaptive immune system, which is what it has grown to become through exposures. So we know that a vitamin C accumulates in some of your white blood cells. It helps to become an antimicrobial. And we understand, at least in some of the studies, that it can both treat and help prevent some respiratory. Again, I'm not giving you doses on this because I don't want you to do this alone. That's really not appropriate. But I want to give you the ideas that there are things out here that can be utilized to help you. The very next one that we talk about is zinc. Zinc is probably a little bit more well known to a lot of people. That's been shown with a strong amount of evidence how it favorably helps the immune system, again, both the adaptive and the innate. We know that it does have an antiviral component to it, so it helps stop viral replication. Now, there are different forms of zinc and there's different doses. And again, this is why you want to talk to your functional medicine provider or your primary care provider to make sure you do it most effectively for you. Vitamin D, which is not actually a vitamin at all, it's a hormone. We do know this is an immune system modulator. So again, it helps deal with your inflammatory cytokines. It reduces them. So it takes away some of that inflammatory load. We also know that it has been shown to be effective, at least in laboratory, against some of the influenzas. And again, COVID is different. It is a virus. So we're having to extrapolate this information and say, if it modulates TGF-beta, will it do that for a patient with COVID? And I will tell you, I think that we're going to find when this is said and done that vitamin D has played a big role. Vitamin D is one, however, that we do need to check its levels via blood. So you'll need to talk to your provider about that because you can do too much D. And for those folks who go, oh, I think my D level's fine, I've got plenty, I would challenge that possibly not, because if you're using products with sunscreen in them, or you're wearing a long sleeve sweater, or you're living in Illinois where we just don't have the intensity for much of the year, you probably don't have the level of vitamin D that you might first think about. Again, great conversation to have with your provider. N-acetylcysteine. N-acetylcysteine helps with glutathione production. And again, in laboratory with rodents, it's been shown to be protective with influenza, but I will tell you there's been a small study, less than 300 patients. However, in that they found that they had significant reduction in influenza symptoms. So again, between you and your provider, you can decide if that's something you might want to add to the mix for you. Elderberry. Elderberry has got a very long historical use as an herbal preparation that's antiviral. You'll see this in a lot of over-the-counter things. We definitely know it helps in an antiviral modulation. So it's very strong in that. The evidence is there. We also know that it can reduce symptoms, both the severity and the duration. So it offers us some help, some symptom relief there. And I'm not by any means suggesting you do all of these. And again, I'm suggesting you don't do any without the coordination of your healthcare provider. Piercetin, we both know, has antiviral effects both against RNA and DNA viruses. The strength of the evidence out there is a bit limited. It's one of those things that's being looked at more now than prior. but it might be something that would be an appropriate part of your treatment protocol in recovery. The EGCG, or epiglycatechin gallate, how's that for? This one we know, this is your green tea. This one has been shown, and there is some limited evidence for it, but it does show regulatory modulation on something called your NLRP3 inflammasome. Big words for part of the inflammatory process. And because it's part of green tea, this is something that you could do without it being a big issue, a big deal. You can just add that maybe to your daily relaxation routine. Curcumin. This has also been shown to regulate that same inflammasome that I just mentioned. And we think that it might reduce viral replication. Again, folks, not a lot of studies on some of these things, but what we do have in this case, the strength of the evidence is about middle of the road, with it being utilized through a provider who can help you with dose and application. I think you can use it with minimal risk, and that's really what it's all about. What is that check and balance system? Melatonin is something you've probably heard a lot about, and this has been one that, again, has an inhibitory effect on that NLRP3 inflammasome. So we know, and it's become, we're curious enough based on what we've seen through COVID, it is now being studied to see if it is something to help actually reduce the chances of contracting COVID, or once you do have it, to reduce those symptoms. So it is, we know it can favorably modulate the antiviral pathology and the inflammatory pathway. So we're still have to learn more about it. I would not suggest that you go get this. It is over the counter, but that would not be my recommendation. My recommendation would be to utilize this again in conjunction with a provider who knows the risk, the benefit, as well as your health, and knows you and knows what you need. Resveratrol, this is one that's been around for a while. It is a naturally occurring polyphenol. Again, conditionally as far as the evidence, but there is some out there that talks about, again, that same modulation of that same pathway, as well as working on those viral pathologies. So again, could be a part of, not talking about doing all of it. You might want to mix and match. Again, that would be up to your functional medicine provider. Pain relief support, that's another big, whether you're doing something OTC or you're doing something anti-inflammatory, diet and lifestyle can be a big part of pain relief. Physical medicine can be a big part of that pain relief. So depending on what you need, and I can't determine that today, what we would be looking at, of course, is your provider looking at this and looking at all of you to come up with a protocol that is best. Again, I mentioned OTC options. They're out there for you. Even though things are natural, I get it. We sometimes assume natural means A-okay to use, but I will state to you that arsenic is naturally occurring, and I don't think that that's appropriate ever, even in moderation, as they say. So please know that even though these are readily available, that they should be used appropriately with clinical judgment and training to make sure that you're getting exactly what you need. As we've talked about, there is no two exact experiences with the COVID and the coronavirus. So depending on whether you've had mild symptomatology, you are someone who has severe and lingering, or you're in that long hauler category, there are things that can be done to help your body get back to healthy, your body back to hopefully where it was to pre-COVID status. And this is something that I would encourage you to do, again, with help, with somebody who's helping you, holding your hand. What I would like to tell you as we conclude our presentation, that here at Aligned Modern Health, we are committed to this. I'm very proud that not only for our patients, but our community, we look to help us get back to pre-coronavirus status. So please feel free to call out and reach us for a 15-minute free consultation. And we're going to see our Q&A. One of the questions that we do have here is, can functional medicine practitioners call for CBC labs? Libby, yes, they can, as long as they are a licensed physician or a licensed provider, and all of ours at Aligned Modern Health are. I'm looking at another question here. I've heard getting the COVID-19 vaccine may help people from suffering from long-term symptoms like fatigue and brain fog. Is that true? And when should people who have had COVID-19 look to get the vaccine? Jennifer, I've heard there's a little bit of conflicting commentary on this so far. When the vaccine first came out, we said maybe if you've already had COVID, we would hold back. Now the general consensus is no, go ahead and look at it and get it. And then the other piece of it is that it does seem that people who've had COVID get the vaccine typically have a fairly significant reaction from the vaccine. And again, not 100% of the time, but some. However, that is not considered a deterrent. So there could possibly be benefit. We're just not fully sure. So I would tell you that I would talk to your provider with your specifics. And if your provider, like I said, if you'd like to talk with us and see what our docs think, we're happy to do that. But it is really a bit of a mixed bag, so I cannot give you a definitive, and I do apologize for that. But there does seem, for some people, it does help, but we're not seeing it absolutely across the board yet. So hopefully we'll know more soon and can give you a better answer. All right. If we did not get to your questions today, I'm so sorry. Please feel free. Everyone who joined us today and is registered will receive, by the end of the week, they will get the presentation. Again, I really appreciate you joining us, and thank you from Aligned Modern Health and myself on behalf of all of us here who want to help our patients and our community get better. Thank you for attending.